Healthcare Improvement Scotland works to drive improvements in health and care. About a year ago, I became conscious that human rights seemed to be cropping up more and more in conversations with staff. They were keen to see us doing some focused work on a couple of our work programmes so that we could understand what the impact is and what the benefit of that would be. And the two that were engaged in that were Our Voice and our Scottish Patient Safety Programme mental health work.
I think human rights is very, very important for SPSP generally, but particularly SPSP mental health. It really puts the service user, the patient, as well as the carer at the centre of everything. And it just refocuses the minds and keeps us away from being too bureaucratic and too number crunching. It's very much putting people first.
We organised a training session for the programme leads and for some of the team members, and the Scottish Human Rights Commission delivered the session and covered the legal framework for human rights and some interactive case study scenarios so that we could start to think about, well, what does this mean?
So we have taken the panel principles as a means of sorting out where we are with regard to human rights. So for instance, under say the legality part of panel principles, our Citizens Voice Hub with its telephone and web-based services will be able to provide information to inquirers about their rights to be involved not only in the shape of their own personal care that they will receive, but also of their rights to be able to take part in the future development of services in Scotland.
I think in terms of tackling a lot of the stigma that still exists around mental health, it's a very useful approach. One of the things we see human rights being useful is kind of changing the balance of power between the service provider and the person receiving the service. I think it's a more positive experience when you are more involved in your own care, when it becomes more of a partnership between the person receiving the services and those providing. And I think there's increasing evidence that the health outcomes are actually better as well.
The thing that's always struck a chord with me around human rights is the Eleanor Roosevelt quote, which is about making human rights meaningful in small places close to home and in the world of individual people. And that for me was very much what this work was about, and actually demonstrating that in the work that we do on a day-to-day basis, these rights are meaningful for us, for our staff, for the people who are using services.
Having carried out an initial exercise to map where we were against the panel principles, we're going to build in indicators into our general outcomes and evaluation plan. And that's very important because that then gives markers that we'll be working against and then reporting against. And that's going to drive the human rights-based approach right into the heart of the Our Voice framework.
As a member of society, I have rights the same as everyone else does. The way I claim these rights may be slightly different, but I think the empowerment and the participation strands of human rights give me that knowledge and that ability to claim what I need to do, and ultimately it's about getting better healthcare.